use those powers in those types of situations.
Davies, final question.
Thank you, Mr. Chair. This week at the 72nd session of the World Health Assembly in Geneva, many observers have publicly expressed their profound disappointment with the Government of Canada's attempts to either oppose or dilute a resolution aimed at reducing drug prices globally through increased transparency for drug companies. If the resolution were passed as originally drafted, many global observers believe it would be a major step towards improving access to affordable medicines as well. And presently, a lack of transparency on drug pricing agreements and research and development costs allows drug companies to charge high and arbitrary and certainly not very transparent prices. Do you have any information to tell the committee why Canada is taking a position at the World Health Assembly that hampers global efforts to reduce the price of pharmaceutical drugs and access to medicine globally?
So, Mr. Chair, I was actually at the World Health Assembly in Geneva and had occasion to be part of some of those discussions. I certainly was. I mean, the negotiations only concluded, I believe, yesterday, so I was not in the room for all of the conversations. But I can share a little bit of the story around this issue. So in the end, I can assure the committee Canada supported the resolution. The resolution was carried at the World Health Assembly sometime in the last...
As originally drafted or as amended?
As amended through what fairly extensive negotiations that went on over a period of days. I would say, having been involved in a lot of these conversations over the years, not just in health but in other sectors, that's fairly standard when you get 170 countries in a room. There's bound to be a lot of discussion. So there were negotiations that carried on over a period of time. In the end, Canada joined the consensus, expressed strong support for the principles around transparency. What I can say is that one of the concerns that the Canadian delegation had, and it was by no means confined to the Canadian delegation, and it's certainly not to criticize the sponsors of the resolution, but typically when these kinds of resolutions come forward, they come forward through a process of regular order where you have some advance notice and you're able to do consultations in your capitals and talk to the various interested parties. And this resolution was tabled basically very close to the start of the meeting. There was very little time available to kind of consult. And a number of the proposed commitments had fairly substantial implications for intellectual property rules and so on beyond the health sector. And so some of the adjustments were frankly to just seeking to add clauses such as consistent with, national laws and circumstances. It was really an effort to just make sure that, we're not in a rushed manner signing up to things where we hadn't actually had a chance to talk to people back in Ottawa in a number of ministries, not just health. So I can just say, in the part of the health ministry, there is strong support for the notion of transparency. There was support for the resolution. We, along with many other countries, wanted to make sure there was some language to allow for further consideration of what would have been fairly profound changes, not just in the health space. Yeah.
Question.
No, sorry.
If I could just ask
go ahead,
you quickly
No
about...
more questions. Sorry, time's up.